I'm Dr. Michelle Albert, and I'm thrilled to be sitting here with Dr. Keith Churchwell. We just had a very powerful session this morning at the American Heart Association meetings related to structural racism as a public health crisis. Dr. Churchwell, you're one of the panelists, and you've also authored the American Heart Association presidential document about structural racism. I would be great for us to talk about some of the potential solutions related to structural racism from your perspective. You're president of Yale New Haven Hospital, so you have a very unique perspective. You're also a cardiologist, so that's great too. So what are your thoughts about this morning's session?
I thought this morning's session was just amazing. It was remarkably enlightening. When we talked about solutions, it was a multi-pronged effort by the panelists to really discuss how we can get from point A to really to point Z in regards to moving this forward. There was a strong emphasis on education. Education not only for the public and also for communities and also for industry, to really understand that the constructs around structural racism have to be broken down, that these barriers are long-standing and have great historical context. And because of that, they're inherently part of our day-to-day operations and part of our systems. This has to be recognized, and we have to have a concerted effort to break those barriers down. Education in regards to bringing really the next generation of educators and scientists and physicians in this arena who actually are people of color, people of the African American community, understand that we have been very persistent in what we have not accomplished over the past 100 years or so, of really developing the next generation of individuals who should be actually working in this particular sphere to help us in regards to in our journey to improve the health of all Americans. We have to be much more concerted, have to put processes and bring a great degree of capability for each part of our industry, from medical school through residency, through fellowship, through attendings, through the NIH, through actually scientific groups, to really understand that we have a significant deficit. It's a deficit really of our own making. But it's an opportunity for us to actually resolve that deficit by reaching out to nurture, to bring individuals present who actually want to be in the sphere and actually allow them to grow in a way that we actually haven't allowed them to grow previously. So with that, and then we did talk about the fact that part of the solution is that we have to be very, we have to work toward really constructs, both and on the educational side, within the community side, and also in the industry side, to put programs in place that actually resolve this issue. That it is a burning platform for us. It's not something that we're going to be able to wait on in the next 5 or 10 years to restudy and reevaluate. That's going to be part of the process, but we need to start moving forward now in working towards the destruct of structural racism and the construction of a better pathway for all of us in terms of improving overall health. And that's really programs within our own industry, especially within the industry that I'm actually actively working in, the hospital industry, the delivery of care industry, to recognize these issues and go forward with within our own local communities to have a more diverse population of individuals taking care of the patients, both on the clinical side, but also on the administrative side. And then say that we're going to actually use the funds we have available to us to actually resolve these issues in a way that actually can not only improve our overall margin from a health energy perspective, but also align ourselves with the mission. There was a statement by Dr. Lowe that actually I will not forget. I will actually probably say it's mine and steal from him for the rest of my career, when he said budgets are actually moral documents. And he is
right about it. Yeah, absolutely.
Wasn't that a great statement?
That was a great statement. I actually was going to ask you about that statement.
So yeah, budgets are moral documents.
Yes.
So as we construct them, we have to take, especially within the healthcare industry, we have to take that into consideration in regards to how do we put the building blocks in place to be successful financially, but also clinically, that actually puts us in the right ethical and moral path. I thought that was fantastic.
No, I thought that was terrific too. And then piggybacking off of something else you said, you talked about, sort of institutions and the C-suites actually taking care of their employees.
Yes.
And could you expand on that?
It's interesting, Michelle. We just did an evaluation of our C-suite employees and our processes for succession and how we are evaluating and identifying personnel. And I've been in this particular job just for a few weeks, but we looked at the list, and the list was not exactly one we were terribly proud of.
Right.
And so and what the good news is that everyone around the table, around the Zoom table, begged the question why. And how concerted an effort that we were making for identifying personnel, mentoring people, mentoring the right people, understanding the needs for those who actually are great to do diversity, to bring them forward so they can actually be an important part of the work that we do within our C-suite environment, and actually promote them, to give them work that actually lets them stretch, to be evaluated, to help them to help us in terms of being problem solvers, so that we can really identify those personnel, so that when we're ready to make those decisions, we have the right cadre to actually be able to make the right choices with. So we have to be really concerted. We have to be thoughtful. We have to really make an effort. It has to become truly part of our culture. It's really not part of our culture, right?
Yeah.
We don't really think about this in a way that actually says reflexively, oh, yes, and we have to understand that this has to be part of what we're going to do. It almost is almost always something oh, by the way, it has to stop being that. It has to be reflexively, oh, yes, and this is 1, 2, 3, and 4 of what we're going to try to accomplish to actually achieve these goals.
That poignant statements, and Dr. Paula Johnson also talked about remapping curricula to educate the workforce.
Yes.
That was a major theme. And another part of our discussion focused on how do you approach others and move the conversation away from individual, sort of racism to more structural racism. And how do you move that?
That's a great question. I think how you frame this question and frame this discussion to have people to understand that why they have been frustrated in not achieving their goals in regards to their employee workforce or within the hospital environment of what we're trying to achieve on multiple levels in regards to programs and places that we want to be. And understanding that underlying that is this issue of structural racism. These are the reasons we have actually gotten to this point, but to get to here, we've got to actually fix this. We've got to fix this as one of the major issues, right?
Right.
We're having people understand that they have these lofty goals of what they want to accomplish around multiple arenas. Fixing this will allow them to have the real pathway to do that. So that's what they have to align to. That's what they have to really recognize and accept. And the acceptance part is difficult, right? But then after that, then become very enthusiastic and really wanting to actually move us in the right direction. So if we can do that, I think that's the right conversation. I think that's actually a difficult conversation, but it is the right conversation.
Yes, indeed. Another part of our conversation focused on the fact that the life expectancy for African Americans is on average 5 years lower than for white Americans. And in fact, the gap in life expectancy actually, in fact, is worse if you're more educated or of higher socioeconomic status background. That is also very startling.
Oh, it's incredibly frustrating. The mortality for coronary bypass graft surgery in this country between white Americans and Black Americans, there's a huge differential between the two. It's the same procedure. How can that be? And it's actually persistent. It isn't even new data. If you go back and actually the evaluation of that data over multiple decades, the data hasn't changed. So that's an understanding that there is really an intrinsic problem in how we actually deliver care. And actually, and underlying that in it is actually the issues around structural racism. The structure in terms of what we have put in place from a historical standpoint on the day-to-day lives, on how we live, how we operate, how we evaluate patients, how we actually treat patients actually in the pre-assessment, within the assessment of their disease, and the post-assessment. That's what we need to understand, and actually what we're going to have to fix.
And certainly David Williams in his presentation talked about structural racism from a neighborhood perspective.
Yes. Yes.
So it goes beyond
Yes.
the structures in place in the hospital, but the racism is very embedded in how our neighborhoods are set up, how our schools are set up,
right,
where we're able to access, quality education.
And that was a remarkable 12 minutes. And the fact that he was able to identify and have us understand there was a concerted effort to do that. And we have not resolved that particular concerted effort within our own neighborhoods because of segregation, the lack of actually nutritional food being available, differential in terms of the school systems between one neighborhood and the other, that we just have to recognize and say that this is inherently the problems that we have right from the beginning that actually then bleed into everything else that we do. This is what we have to confront and fix. Yes.
Absolutely. And so this was a session that was jointly sponsored by the American Heart Association, the Association of Black Cardiologists. We're both, members of both organizations.
Yeah.
And certainly longstanding members. And certainly there are, 5 things that, we've been, sort of putting out there as potential solutions. One includes advocating for public policy and institutional initiatives that eliminate educational and economic disparities. Another is addressing access to equitable and quality healthcare. Another is promoting diversity in clinical trials, not just for patients, but also for investigators, because it's the investigators who actually ask the important questions. Another is addressing the pipeline of personnel in medicines to significantly increase the numbers of persons who are from disadvantaged racial and ethnic and socioeconomic backgrounds to equitably enter, and then by addressing structural racism. So I now want to pivot to structural racism based on the article that you chaired for the American Heart Association, which puts out a call of action to address structural racism. Could you tell us a little bit about some of the plans related to structural racism?
So one of the things I think people should realize is that this was not a new idea from AHA. This is, I think, the scientific journey on health equity that AHA has been on for many years. This is really a culmination of those particular efforts, and the events over the past few months, over the past eight months, really has been a flashpoint for us to really go forward and put those thoughts to paper and think about what are the next steps. Now, we decided within the paper that it was important for the American Heart Association to one develop a really definitions of what we're really talking about. So there's a figure about the taxonomy of the terms that we use. And we all thought that was important. There's going to be some degree of controversy and discussion in terms of what means what, but in terms of how we go forward in regards to additional papers and additional scientific evaluation of these particular issues, at least we actually have a baseline of what we're really talking about. We also decided it was a really good idea to put structural racism in terms of a historical context, to really tie in the issues that have gone on from slavery through the Civil War, through Jim Crow, through the redlining issues, through our whole history and the civil rights issues about how that has affected us as a people, African Americans in particularly, and then the straight line to that in terms of its overall impact on overall health. We aren't historians, of course, but we do understand history. And then we talked about then our current state, I think, of where we are, and the issues that our panel discussed today, that you have actually talked about and illuminated, where Association of Black Cardiologists have been thinking about in terms of next steps. And then we talked about future state, which I think was important in terms of where we want to get to, and then how. You mentioned the concepts and the precepts that the ABC has put together in terms of how they're going to go forward. They're very much aligned, I think, in what we and in the paper in AHA also have thought through as an organization of how we need to approach this. One, we talked about advocacy, and that's something that AHA does extremely well. We need to advocate at the local, regional, national level about this issue and how we need to go forward in terms of the deconstruction of structural racism and actually how we need to move forward, both from a legal standpoint, from a political standpoint, and from an organizational standpoint at the local level. We then talk about the fact that we have an opportunity actually within our own system. We have relationships with hospitals and institutions, and looking at themselves as actually high quality organizations around cardiovascular and cerebral vascular health. Adding in the concepts of how you are thinking about equity and diversity and inclusion within your own environment, and saying to be a high quality organization, you need to actually address these issues and bring solutions to your own institution and hospital in that addressing. That's actually going to say that on top of that, that's how we're actually going to actually truly take care of the population that is at risk. We also talk about leadership from AHA, but also how do we actually bring other partners into this particular forum, like ABC, like the media, like the ACC, like the AMA, like other organizations that are really outside of the medical environment, to say that we all need to lead in terms of the discussion and also in terms of solutions. We also thought about the fact that we have the opportunity to look also inward at the AHA and ask ourselves, where have we been in this particular political thought, these issues over its 100 years? What can we do better? How can we actually become truly a diverse, equitable, inclusive organization as a standard that others can look to on how to do this well as we go forward to actually make ourselves better? And then finally, we talked about the fact that something that AHA does extremely well is science around the evaluation of a particular physiological, pathophysiological state. The science around structural racism itself is actually limited. There is a great opportunity for a greater degree of understanding in terms of its cause and root and its overall analysis, and also thinking about what are the pathways to its overall betterment. What are the things that we truly need to do that are actually going to really move us in the right direction, elevate the bar to work towards a better state. So that's something we can actually invest in from a philanthropic standpoint, invest in terms of looking at our overall councils to say to all of us, this needs to be part of our overall dialogue. They also opportunity to actually bring young people, in particular, new scientists, new physicians, who actually will have an interest in this particular subject matter, and invest in them to help us bring solutions to it.
Absolutely. That was a mouthful. As someone who has devoted my career to studying these issues related to stress, racism, and health, it is fantastic to see global communities having interest in this particular topic. So these are all difficult issues, and it will take more than a village. It will take the global community to solve it. So please join. Please look at the session, Structural Racism, a Public Health Crisis, from the American Heart Association, the Association of Black Cardiologists. It was a very powerful meeting of experts and panelists. Thank you very much.
Thank you, Michelle. Glad to be a part of it.